Your baby moves it, move it. Your baby moves it, move it. Your baby should move it. So what should you expect from your fetal movements in pregnancy start to finish? I'm Angie, I've been a practicing midwife for the last 13 years, and you can hit the follow button for more pregnancy, birth and parenting information. So where most people will start to feel fetal movements happening is at the front. Our skin has lots of nerve fibres that are very sensitive to babies' kicks and movements and flutters. And these will often start with flutters and almost like butterfly feelings within your tummy. Everyone should start feeling their baby kick and move by 24 weeks of pregnancy. And most people will say that their movements start anywhere from 16 weeks of pregnancy onwards. Now for those with anterior placenta, so this is where your placenta is at the front of your tummy, they will struggle to feel baby's movements as early as 16 weeks more often than not, and they will be towards the later end of the 24 weeks. And the reason it's harder to feel with an anterior placenta, particularly in those early gestations, is firstly, your uterus is still quite small at this stage. You have a much smaller baby where actually the strength of their kicks and their punches aren't as strong as, say, a baby who is closer to term. If you've got an anterior placenta, it's waiting until the uterus and the baby is big enough to be able to get the sensations to the skin. You're going to feel those movements far easier. Having an anterior placenta really is like having a cushion between you and your baby. And the other aspect to think about is whether this is your first baby or not. Those with much stronger core strength, you've got to think you've got a layer of abdominal muscles and abdominal muscle wall to be able to get through, to be able to feel your baby's kicks and punches at skin surface level. As that pregnancy continues, what often happens is the abdominal muscles separate. The more babies that you have, the earlier that separates, the more pregnant that you look much earlier on. But also you tend to find that women who've had babies before feel their movements far quicker and earlier than people having their first baby. And that's because in first babies, the core strength tends to be much stronger. Again, it's that extra layer between you and your baby when you start feeling those movements. Every woman and person should be given your maternity assessment and triage lines at the start of your pregnancy. So if you have any symptoms, anything that you are concerned about, your baby's movements change, you need to give them a phone call. And everyone should be provided with a copy either electronically or alternatively in paper format of Tommy's Feeling Your Baby Move. It's a sign that they are well. And the Tommy's information leaflet gives you everything that you need to know. If by 24 weeks of pregnancy you are not feeling your baby move, you need to be calling your maternity assessment lines. As your baby gets bigger, you will start to feel stronger kicks, punches, movements. And by around 32 weeks, your baby should be in some sort of pattern, whatever is normal for your baby. Never compare your baby's movements to another person's or to another baby that you've had in the past. Some will move just after meal times where they have that surge of glucose through the placenta. Some will have it first thing in the morning. Some will have it all night long. Every baby is different. Get to know when you expect your baby to move and how frequently that should be. If your baby is getting enough oxygen, they have the energy to move. If at any stage there is concerns with them, with their placenta, with their cord flow, whatever it is, one of the first signs and symptoms that they will do to let you know that they are not as happy is they will reduce the amount that they are moving. And the reason we say a change in pattern is because some babies, from some of the research papers that we have got, move excessively before they're about to stop moving. And so that's why the guidance of any changes at all in your baby's movements that you don't normally expect, you need to be calling your maternity triage lines ASAP so that you can get an assessment urgently, get baby checked over, get you checked over and make sure everything is okay. And just to debunk some myths, babies do not slow down the more due you become. They don't run out of room. They should still be kicking and punching you as you would normally expect. And in labour, you should still have kicks and punches. It's a really reassuring sign that your baby's getting enough oxygen in labour and birth. Never use a handheld Doppler. After 26 weeks of pregnancy, you should be having continuous fetal heart rate monitors to see whether your baby is well or not if you have any concerns with your baby's movements. And the only place to check your baby's well-being is in a maternity unit. Never be afraid to get checked over. Your maternity units are open 365 days a year, 24/7. Give them a phone call. And just for reassurance, maternity units see thousands of admissions for reduced fetal movements every single year, and only a small handful are those where there are concerns found, and it's where timely intervention, timely input is really key. Please never delay, and please always go in and get checked over. Don't delay going in at any stage.